You know, it's hard to believe how quickly time goes. Did you know that in 2 days, the world is going to mark with sorrow the first anniversary of the Nepal earthquake? 8,000 people were killed and more than 21,000 people were injured. 21,000 people were injured. Now, the world's attention has since moved on to subsequent natural disasters, but the suffering and the healing continues in Nepal and will for some time to come. Our next speaker has taken his skills as a physiotherapist right into the middle of it. When I connected with Phil Sheppard, leading up to his appearance here today, he was so looking forward to the room in the Marriott that we had booked for him. He said, after living in a tent for the better part of the year, 4 walls of any kind are pretty inviting. So we're about to have a very happy speaker here today. Phil is a global health practitioner currently working for the International Organization for Migration in Nepal as a rehabilitation consultant. He's developing a step-down care facility in one of the regions worst affected from the earthquakes. Please welcome to Vancouver and to Forum 2016, Phil Sheppard. Thank you. Good to have you here, Phil.
All right, thank you. And thanks for that, the great introduction. I'm glad you shared that I was looking forward to the room. It's an honor to be here to speak with you today. Even though I'm from Ottawa, I arrived back from Nepal around a week ago, and coming to BC really feels like coming home. Northern British Columbia is the first place that I worked as a physiotherapist, and I have such fond memories of working and living in a mountain town and having the opportunity to work with such incredible people. And today, just like when I arrived in BC the first week, I've received such a warm welcome. It was probably around 3 days into my time in British Columbia. I just drove across the country, didn't really know anyone, and I get a call at around 10 o'clock at night. And I look at it, it's a BC number. I'm thinking, okay, who's this? And I answer it, hello? Hello, Phil, this is Jason Coolin talking. And I was just so blown away. And we got talking, and it ended up, he said something along the lines of, well, anyone who went to StFX and then went to Queens and made their way out west is definitely welcome, and we're more than happy to have you involved. And that's just one example of the many people that reached out to me when I first got here and today too. So it's great to see old friends and to meet new ones. And so thank you to PABC for putting this on, and thank you for sharing your Saturday with me. Now imagine a regular Saturday afternoon. Think about what you would normally be doing. Maybe spending time with family, going shopping, being with friends. Maybe the last couple days has been so nice, going for a hike. Well, this is the scene in Nepal almost exactly 1 year ago today, on a Saturday. So this is just outside of the Kathmandu Mall, overlooking a busy bus park. So people would have been shopping, getting in and out of buses and tuk-tuks, hanging out with their families. So much similar to maybe what you would be doing here, maybe minus the tuk-tuk part, but hanging out with families for sure. But then suddenly, without warning, everything changed. The ground started to shake. There was a rumble like an airplane passing just feet above your head. People were running frantically out of buildings, trying to find any open space they could. Others were paralyzed by fear as buildings came crashing to the ground, sending clouds of smoke into the air. The first earthquake lasted around 45 seconds, and the second came shortly after. In less than 1 minute, more than 8,000 people died. Over 21,000 were injured, and the fate of a country was forever changed. Now, this experience also profoundly changed my life, and this is why I stand here today, to share with you what I've learned from this terrible disaster and how my view of physiotherapy in the world has changed. I happened to be in Nepal on that Saturday. I was just finishing working in Kathmandu as a clinical instructor, and I was taking a break hiking through the Annapurna Range. I was on the second floor of a tea house when the earthquake started. And I managed to get out, and less than 30 seconds later, the building I was in partially collapsed. We were getting reports through limited cell phone service that all of Kathmandu was destroyed and that parts of Pokhara, the city that I was closest to, was buried under rubble and debris. And as a physiotherapist with global health experience, I just felt like I needed to get back to do whatever I could to help. Over the past year, I've worked from the immediate response to the recovery phases of the disaster. And through my experiences, I want to share with you the importance of rehabilitation and the role of physiotherapists in disaster response, our collective responsibility to work ethically and collaboratively, and to really think about what we're doing before we embark in this type of work or take part in these missions. And also how the experiences and the lessons I've learned translate to your practice here in Canada and around the globe. So let's talk about disasters. There were 3 times more disasters between the years 2000 and 2009 than there were between the years 1980 and 1989. So in 20 years, we've seen a 3-fold increase in the total number of disasters in the world. And this has to do with a lot of reasons, but we're pretty sure that humans have some part to play in this. Now, along with the increase in total number, there's also been a shift from high mortality to increased morbidity, meaning that there are now more people surviving with some form of injury or disability. And more people are surviving because of a lot of reasons. One being our improved response. So we're able to reach people in far-flung areas by helicopter and improved search and rescue. We've seen advances in emergency medicine, so we're now able to bring people back from the brink of death and save their lives. A great thing. And we also have readily available antibiotics that are now more cost-effective and infection control practices, so we can prevent the spread of infection disease after mass casualty situations. So we're getting pretty good at saving lives. But because of that, there are more and more people surviving with long-term impairments and disabilities. If we're going to save lives, it's our responsibility to continue to support these individuals to give quality to those lives. And that is where physiotherapy comes in. And this is what you do every day. You make lives worth living. So because of this increase in the total number of disasters, the shift from high mortality to increased morbidity, and the effectiveness of what you do, physiotherapy and rehab is now mainstream in all parts of the disaster continuum. So the disaster continuum is what's shown up here. It consists of 4 phases after a disaster. And physiotherapists have an important role to play in the response, in the recovery, and the preparedness phases. The prevention has to do with avoiding disasters, such as building dams or diverting rivers to avoid floods. So we're going to talk about the other 3. So I made my way back to Pokhara, and there were mass numbers of people going to the hospital. Some were being transported by the military and hospitals, and others were being transported by any means possible. A friend's back, a basket. I even saw one man who had a suspected spinal cord injury, who was virtually thrown onto a sheet with 2 bamboo sticks and carried to the hospital. And I know, as a physiotherapist, I know what you're thinking. But was this done safely? And how did we avoid secondary injuries? And that's the first thing that we can do. Physiotherapists have an important role to play in getting people safely from the communities to the emergency rooms. And the emergency rooms are such a chaotic scene. The doctors and nurses are doing what they do best, and they're saving lives. But physiotherapists can also help by triaging patients to decrease the burden on the medical system. And either help people, if they're functional and medically ready to go home, we can help them get there, or we can move them to the wards for continuing care. When they're in the wards, we need to get people moving. We all know that getting people moving early improves their outcome, prevents the risk of secondary conditions such as pressure sores and cardiorespiratory techniques. But along with that, we're also helping people go home faster. And there are thousands of people waiting to go to the hospital. So by getting people moving and more functional, we're decreasing the burden on the acute hospital resources. So after my time in Pokhara, I spent around a month supporting Nepalese colleagues who were working on exactly this, maximizing function to improve outcomes for the patient, but also efficiency of the hospitals. Now, when people are discharged from the hospital, they need somewhere to go. And Nepal is very interesting because the majority of the infrastructure and healthcare is located in Kathmandu. It would be like if there was a disaster in Prince George and we had all of our care and rehab located in Vancouver. It doesn't make the most sense, but that's where all of their infrastructure is. So later in the response, I returned to Nepal to work with the International Organization for Migration to set up what's called a step-down care facility. And we made this so that people had a place to go after they left the hospital and before they went home. And we provided this in the communities that was most affected. And in developing it, we collaborated with Nepalese colleagues, the government, and the local hospital so that we had stakeholders and it's a sustainable program. Now, through all aspects of the disaster continuum, physiotherapists have a very important role to play, not only in clinical work, but in collaborating with partners from around the globe and from within the country to advocate for disability and rehab to be included in not only the disaster continuum, but all parts of the development of the country. So to develop long-term strategic plans for disability and rehab. So we've covered the role of the physiotherapist in the response, from getting people safely from the communities to the hospitals, maximizing function to improve outcomes and efficiency of hospitals, providing care that's close to home, and collaborating and advocating for disability and rehab. So what comes next? Next is the recovery phase. So when we think about recovery, we typically use what's called the Build Back Better principles. And this was used mainly in rebuilding infrastructure. So the idea behind after a disaster and after earthquake is to build earthquake-resistant houses to prevent future injury and disaster from that. But we can also use this in rehab to build more inclusive and accessible societies. And we can do this as physiotherapists by developing policy, ensuring adequate funding for persons with disabilities, and that includes not only providing funding so they can seek care, but providing funding for education and vocational training because they're going to have to change their jobs. And also making sure that not only are we building safe houses, but we're building accessible ones as well that everyone can access. So the next phase would be prevention, but as I mentioned there, this really has to do with geologists and engineers to help prevent future disasters and avoid them. But this is a very common scene in Kathmandu right now, and those sticks won't hold forever. So all of the lessons learned from the disaster response and recovery phases help to inform the preparedness phase. And in my opinion, this is the most important part. With adequate training and preparedness, we can decrease the effects and the negative effects of disaster. I mentioned earlier that physiotherapists have an important role in transferring patients from communities to hospitals. But wouldn't it be better if we trained emergency teams and the military to do this? Because ultimately, they'll be the ones that are accessing people first. And this is the time to do it in the preparedness phase. But it doesn't stop there. We can generally predict the types of injuries that will occur after a disaster. So for instance, after an earthquake, we know that there'll be a lot of crush injuries from falling debris and houses that are collapsing. We know that there'll be a lot of lower limb fractures from people jumping out of windows and running downstairs. And we also know that there'll be a smaller percentage of spinal cord injuries, amputations, and acquired brain injuries. So we can use this information to build upon local capacity so that they're able to respond quickly, efficiently, and sustain their treatment throughout the whole continuum of that patient's care. We can also use this information to prepare equipment and resources. So a good friend of mine in Nepal, who's a physiotherapist, his name is Sunil, he's written extensively on how the Nepalese physiotherapists were able to respond within hours of the disaster because of their preparedness plans and of stockpiling equipment. So they were actually there within hours after, at each hospital, distributing mobility aids to people that were injured. At the same time, physiotherapists, as you know, and rehab professionals, it's often the first time that people and patients get a chance to speak and actually recount the events. So we need to equip rehab professionals and physiotherapists on different strategies like psychological first aid and different coping mechanisms so that we can help people process the events and cope with the psychological trauma that they've been through. Now again, hands-on training or hands-on care is only one part of what a physiotherapist should be doing. The preparedness phase is the time to plan the disaster in the continuum of care. So we should know where all the rehab services are in the country, and if one is destroyed, where will we send people? We also need to develop systems to track patients so that they're not lost in the chaos, because many patients are. So the preparedness phase has a lot to do with building capacity and planning an effective response. So we've talked about our role from the response, the recovery, and the preparedness. And as you might have expected, physiotherapists have an important role to play in hands-on care. But this should be done by local physiotherapists and national capacity. We should not be doing this. The other roles, such as building capacity, planning the response, developing policy, that is where the internationals come in. But only if we're needed, not if there's local capacity to do this. In order for physio to be effective, our work needs to be done in a manner that's ethical, collaborative, and efficient. And it's sustainable. We can do a lot of harm as physiotherapists coming in, and that goes from disaster response to development work. So we really need to critically analyze what we're doing and think about the potential harm before we embark in this type of work. Too often I get emails and people contact me and they say, "Hey Phil, I heard what you're doing. I want to come help. I want to come treat people for 2 weeks." Okay, that's great, but maybe not the most effective, because what I was saying is that the nationals should be the one that is doing the hands-on care. And there were a lot of reports of this happening in Haiti in 2010 after the earthquake. And 6 years later, Haiti is still recovering from the effects of the disaster, but also the effects of our response to that disaster. But the silver lining in that case is that we've used a lot of the lessons learned from Haiti to create a coordinated and collaborative response in Nepal. So 1 year later, Nepal has some great stories to report. The Nepalese healthcare workers and physiotherapists demonstrated incredible capacity and leadership after the disaster. The Nepalese are leading the development of a long-term policy and plan on disability in the country. The Nepalese have implemented long-term rehab programs, and they're running them, and they're sustainable. And the Nepalese are finding ways to reach people and provide rehabilitation in far-flung areas. The internationals came in and supported, but it was the Nepalese that implemented and showed their leadership and capacity in this. So this demonstrates the importance of effective collaboration, working and taking into account cultural values, and working in an ethical manner. So rather than imposing ideas and providing treatment, supporting colleagues and nationals allowed relationships and systems to flourish naturally. All right, so we've talked about the role of physiotherapists in disaster response to preparedness, and our collective responsibility to do things ethically and to think about what we're doing. So how does this apply to you? The 3 lessons I've learned is family, function, family, and collaboration. In Nepal or any resource-poor setting or low-resource setting, we have to think about function first. When someone comes in with a back pain or knee pain, we think, wow, that person is now dependent on people for everything. We need to get them back to farming, fetching water, or carrying their baby. Think about this. To go to the bathroom, you have to be able to have a full squat Now, this requires a lot more movement and function than sitting on a chair, doesn't it? So the effects of decreased function are staring you right in the face. So it's easy to see that we need to work on that. So on top of this, there are hundreds and thousands of people that are waiting to seek rehab care so they can go home and be with their families and provide and work in gainful employment. So by improving function, we're allowing people to go home and interact with their communities and participate in their societies. And that's exactly what we did at the step-down care facility. We implemented a program that focused on high-intensity functional rehabilitation. And we didn't have the luxury of using fancy equipment, so we used exercise, and we had fantastic results. So what can we learn? When you're working with your patients, don't see the patient as a knee or back. Think of the patient as a brother or a sister who needs to get back to their families and be able to take care of them and interact with their societies. Think about the end functional goal and use this to tailor and create your treatment program. So at our facility, function was so important that we built a garden because most of the people in the area were farmers. So we built an area where they can practice how to plant seeds, or we could also modify their technique to suit their new ability. Family. In many countries, family and community is the most important thing. In Nepal, people live with their families their whole lives, and when their parents get old, the children take care of them. Family and community is so important that at the step-down facility that we developed, we had capacity for 40, but only 20 were for patients. 20 were for a family member or a friend, because we knew that by including a family member, it would improve outcomes for the patient and make the entire family and community an active part of the rehab. We also geared everything towards group activities. So we had group exercise classes, group psychosocial programs, and group self-care time. And this allowed people to get the same type of support and guidance that they would receive in their own communities. And we had fantastic results from this. People that hated exercising individually loved going to these group exercise classes because they could support each other through all of the difficult times and they could discuss even the trauma that they experienced. So what can we learn? Let's bring people in and encourage family and friends to take an active part in the rehab of our patients. We know that the follow-up of the patient will be improved. They're more likely to continue their exercises at home, and in the end, it makes everything more fun. So let's include family. Collaboration. The most important lesson that I've learned is collaboration, which is why I've mentioned it probably 100 times by now. But I think it's very important in all aspects of our lives, especially when we're treating patients or when we're working in global health and developing programs. In the same way that you work with your client and you collaborate with them to meet their goals, those same principles apply when you're working in global health or any kind of project development. You need to collaborate with your partners and your colleagues and support them in achieving their goals, not yours. So what can we learn? By using collaboration, we create systems that are, again, more sustainable and everlasting. We create relationships that will last for a lifetime. And in the end, again, it's more enjoyable for everyone. So when working in Canada or around the globe, think about how you'll include function and family when treating your patients or when working in development. And make sure you're collaborating with your clients and your colleagues to achieve their goals. So we know that rehabilitation and physiotherapy is important in disaster response and in development work. And that it's our collective responsibility to think about what we're doing and to critically analyze the work that we're doing to prevent harm. And we've seen how a few of these principles apply to your practice here in Canada and around the globe. But it doesn't take a disaster or a global issue to have an impact. There are issues within your own communities, in your neighborhoods, and within your own province. There are people in this room who are doing incredible work in rural and remote parts of British Columbia. And I encourage you to contact these people to see how you can help. Because as a physiotherapist, you can have a profound impact on people's lives. And I believe that it's our duty to advocate for equity in healthcare. So get involved with your communities within BC, in Canada, or internationally. Be a great physio, but also be an agent for change. You speak with people every day who tell you how physiotherapy has changed their lives. So it's our responsibility to speak for our patients and the less fortunate, to make sure that we're providing care and rehabilitation to those in need. That we're continuing to support people to improve quality of life regardless of gender, of race, of socioeconomic status, or location. Thank you.